Let's get a closer look at what's happening with COVID in China with David Dodd. David is chairman and CEO of GeoVax Labs, a biotech firm currently working to develop a coronavirus vaccine. Welcome to the show.
Thank you. Thank you, Elaine.
David, much has been made of China's zero COVID policy, some even saying the world needs China to continue with that approach. And we are seeing some manufacturing going back online in Shanghai. What do you make of trying to really balance public health and the economy?
Well, this work towards balancing is a real challenge. I mean, there is no perfect answer, and there is no solution that we can just simply calculate. So those in decision-making positions, either in public health or in economic decisions in the government, they have to decide what they feel is best at the particular time. And it, quite frankly, is a real challenge because you're trying to balance the spread and minimize the spread and severity resulting from COVID. At the same time, you want to maintain a certain economic vibrancy to be able to keep the economy going and keep people employed. No, and it's a real challenge, and there's no perfect answer. And things have progressed and things have gone backward. I mean, we had a relatively good report of the first quarter for China, but in the most recent months, you're seeing a decline from a combination of COVID and also, the impact on production of the war in Ukraine.
Well, that's very true. There was a lot of global optimism at the beginning of this year when it came to COVID and the economy, and then Omicron hit. Talk to us about your decision making as you see these waves, when you see the global supply chain issues right now in factory production.
So, the whole impact on the economy are a bunch of different pieces that all come together that, when people aren't able to go to work and they aren't able to do the jobs that they're trying to do, and we're not able to produce or ship products out, it's going to have a tremendous negative impact on the economy. But at the same time, we're continuing to see an evolution of this SARS-CoV-2 or this virus and all. And so we're seeing the Omicron, we're seeing the BA1, then the BA2, and then the combination thereof, and what they're referring to as variants of concern or VOCs. And those are going to continue to emerge. I think now everybody is in sync with the concept that we're going to see a continued evolution of this virus. We're going to see continued variants coming to bear, and what's going to be important is to have the tools, which are vaccines and therapeutics, and it's probably going to be the next generation vaccines and therapeutics that enable us to minimize the severity and certainly reduce the likelihood of death. I mean, we can't prevent infection, but what we can do is reduce and minimize hospitalization and severity. In certain populations, the elderly, those with comorbidities, those with compromised immune systems, and those with genetic types of conditions such as multiple sclerosis, they are at the highest risk. The rest of the population, by and large, is going to be able to deal with this.
So as the CEO of a biotech company, what has struck you over the past 2+ years as this virus continues to mutate? And talk to us about adjusting to those changes from your viewpoint.
Well, what has struck many of us is that this hasn't gone away. Many of us at the very beginning took the understanding and the approach that we felt that this virus was not going to be here today and gone tomorrow, such as the first SARS virus that we experienced like 17, 18 years ago. That was not the case. So some of us began to plan and build for a continued evolution of this virus that would continue to require next generation vaccines. So the initial vaccines gave us very strong antibody responses, but they're not very durable. So we're seeing these waning. So we need to move forward with vaccines that can target specific populations that are at greater risk, be able to accommodate those, and be able to be durable. And so that's what some of us are working on right now and have products in clinical trials. And also the implementation of therapeutics that can also address people who are already infected becomes very important. But at the same time, I think it's well recognized, certainly in the United States, that what is most important is to try and balance that by keeping the economic engine going. We cannot shut everything down and think that it's not going to kill the virus. It's not going to stop the virus. What we need to do is use the scientific tools to minimize the impact of the virus, while enabling people to do what they do best, which is create economic value.
We have about 30 seconds left. I got to ask you quickly about the news of the United States dropping the federal mask mandate. What do you make of that decision? Is it too soon as different countries handle, as you mentioned, this pandemic in different ways?
Well, I'm attending the World Vaccine Congress here in Washington, D.C. this week, and it's people all over the world. And we heard about the announcement. I think by and large, people are saying it's the right decision. I think we're at a point now where this virus is becoming endemic. We need to figure out how to best manage that, how to be able to extend the benefits of vaccines and also to implement more therapeutics, but at the same time allow people to get back to normalcy in terms of their work, the economic production that they have. And that balance is what you talked about at the very beginning. We need to have that, and we cannot simply focus on just the virus.
David Dodd, Chairman and CEO of GeoVax Labs, we appreciate your time. Thank you for joining us.